Thank you for listening to Value-Based Care Insights, a podcast by Lumina Health Partners. I'm your host, Shaillee Juneja. The series is for healthcare leaders and organizations navigating the journey to value-based care and the ever-changing landscape of our healthcare industry. And boy, has that been true for the exceptional year we've had and the one we've just started. Our goal in this series is to bring to you disruptive success strategies for healthcare organizations, leveraging our experience and having worked with some of industry's top experts and thought leaders. Before we get into today's episode, I'd like to invite you to leave us a review on Apple Podcasts and let us know what you think about the episode and other questions that are top of your mind. With that, I'd like to welcome my co-host, Dan Marino, Managing Partner at Lumina and an industry thought leader for value-based care. Dan, welcome. In our last couple of episodes, we've talked about various trends, not only that we've observed coming out of 2020, what our learnings have been, but what we anticipate in 2021. We've talked about technology trends, data trends, policy changes that are anticipated. And I'm quite excited to talk about today's episode, our focus on need for strong leadership, resilient leadership, as we navigate and build ourselves back into 2021. What are you hearing on this topic, Dan?
Obviously, given all the challenges that we've seen in this past year, particularly with COVID, and a lot of the pressures that have been placed on hospitals, both in terms of the financial pressures around delivering good care, pressures around just, building the right culture, physician leadership is really bubbling up to an area of great importance. And, what I'm particularly hearing is leadership and the skills required, for these effective, high-performing leaders, not only is important within the executive branch of these hospitals, but also within the physician support structure. Many physicians are assuming these leadership roles. And, they're the skills that are going to be required to get us past a lot of these activities within COVID, I think are going to continue to emerge as an area of real importance.
Absolutely. And, when we talk about skills, Dan, it's not only the operational skills, the operational knowledge the physician leaders need, whether that be on the value-based care, whether that be on payer contracting, analytics, or technology. I think ever more there is an importance and there is a focus on need for soft skills to not only sustain the increasing demands of this role, but to excel at it as well.
Oh, you are absolutely right. And those soft skills lead to appropriate execution of the strategy, of the business models, and really building the culture so the team can be effective. That's what I think is really important. Well, Shaillee, I am really excited today to have a returning guest, Dr. Doug McKinley. Dr. McKinley is a clinical psychologist. He specializes in leadership development of physician executives, has worked with many physician leaders across the country, many organizations across the country. And as you recall, Doug was with us, I think it was last summer. We had brought him in to provide some insights on burnout of physicians and maybe how physicians need to kind of develop their coping skills to help them get through a lot of the COVID activities. Doug, really happy to have you back. How are you?
I'm very good. Thanks, Dan. Thanks, Shaillee.
So, Doug, I know you're continuing to work with folks around the country. As we've talked about, the leaders of today, I think, are really challenged with helping to guide and plot the right course to not only improve the financial performance, but also drive a lot of the clinical activities, just to create that confidence with the patients, right? Sure. And I know you've done a lot of work with physicians and physician leadership. What are some of the things that you're hearing or some of the real needs and even some of the challenges that you're hearing out there?
Well, first of all, it's been a wild year, as Shaillee mentioned in the intro. What they need right now is rest. So they need to breathe. It's been really interesting. But in terms of this conversation, I'm kind of torn between awareness of the need and also the skills, the upskill that's needed. So I think more vigilance around the fact that we can't just keep doing things the same way, expecting a different result. So that's what I mean by just being more aware of the lack of leadership acumen and development. And then also, it's an upskill. A lot of docs assume that because they're a great doctor, they know how to lead. They do. They know how to lead a surgical room. They know how to lead treatment, but leading in the milieu and in organizational leading is so much different, as both of you know.
Yeah, you're absolutely right. And we're seeing more and more physicians placed in prominent roles, cancer service lines or neuroscience service lines. And obviously they're placed in those roles because they're strong clinical leaders and they're visionaries in their field. But I think they do struggle with some of the business areas. And I think that's where, an opportunity to develop and to improve those skills, or at least giving them the support in those areas, I think can drive tremendous amount of personal and professional success for them.
Yeah, it's really interesting. What I've noticed, you're both familiar with the MD, MBA combination, right? So a lot of docs are being mentored and told to get their MBA because that will help them. But so far, my experience with MBAs is that one area they don't seem to be equipped to train as well as leadership. You learn the business acumen, and these are really smart people. So I think there's a big gap there. And I've taught for a couple of the executive MBA programs. I'm still on adjunct faculty a couple places, and I always insist that I teach leadership because I'm pretty sure they're not going to get it. So that's in the last 15 years. So it's definitely, I'm hearing that it's getting better, but I just don't know.
When you've worked with physicians, in developing their leadership skills, what's your approach? What are the couple of things that you've done that I think you've found successful as you've started to develop the physician leader, and I guess bridge the gap between maybe their strategy of developing, let's say, a service line versus executing on that strategy and creating the team to help support it?
I think if I'm being really transparent, they need to get over themselves. I think my first conversation is always about hubris, and I know you're smart and you know a lot, but it doesn't mean this is something you know about. So I think I always start with trying to have a conversation about humility and becoming a new learner. It's challenging. There's a lot of resistance to my comments around that. Of course, I'm supposed to be skilled at maneuvering those conversations, and I think I'm fairly good, but it's a tough bridge to get across sometimes.
Well, it is. And what I've found, and I've had the opportunity to work with many new physician leaders, my work has really been on the development of and supporting them on the business side.
Right.
And we get asked many times for them, what are some of the key programs, leadership programs that are out there that they can go to? And, the feedback that I've heard from many of them is that, they've been taught this information, they get this information, and then they bring it back to their organization, and they have trouble executing on it. And it sort of brings me back to something you've talked about time and time again. It's that closing the knowledge do gap. And maybe you talk about that. I think that's just such a relevant point in our discussion for today.
Yeah, I will. I think, right. Just another thought I had from your previous question is, I don't think the gap is that much different than, say, an individual contributor coming up through the business lines. I mean, they're really good at an individual contributor role, and suddenly they get promoted to a team leader, and it is a jump. I mean, it's a jump to move from individual contributor to team leader, and then team leader to executive, and then executive to leader. So I don't want to give the physicians an unfair slant against them. I think it's a gap that a lot of people struggle with, but physicians particularly, because they are bright, clearly, and I love where you're leading this to. Just because you can read a book about leadership doesn't mean it's so. And I think when we were, if I recall, when we were talking about this conversation, I was reminded back to 1989 and 90 when I was working on my PhD dissertation. I should say PsyD dissertation. I did a qualitative or a quantitative study of the gap between people's what they believe they know and what they actually do. And so it's more focused on the belief part of the knowing than just the knowing. But back then, some whatever that is, 30 some years ago, there was no statistical correlation between what people profess and what they actually behave. And so this knowing do gap has been around a long time. I think it's a real thing. I think we're obsessed with knowledge in our culture, at least in the Western culture. I can't speak to others, but we like to acquire knowledge. But there's no evidence that by gaining more knowledge, we actually make the world a better place. In fact, there's lots of evidence we don't. There's evidence when we do better that the world is a better place. And so I think one of the quotes I love hearing is you can't talk your way out of a problem you created. You have to behave your way out. So it's there. We all understand it. It starts in grade school and high school and college, where we understand, we learn things, but we have to get out and actually do things. So if you ask me what's the best way to develop a young physician into leadership, is to get them out and get them involved, let them practice what they're doing. And so the best efficacy we're finding in development programs around the world is project-based development. That's give them something to work on, give them a mentor and a coach, and then we'll teach you along the way.
Well, and I think if you can build that around, say a practical case study, or maybe, their own work that they're either assigned to or that they have responsibility for, well, then it becomes real, right? Because then you're developing these skills around something that, you have both the personal and professional stake with. And I think you're able to, in my mind, there's no better learning than that.
Right. Yeah, so the knowledge do gap is real. It's just not enough. There's so many great books out there on leadership, and you can get TED Talks and webinars. I listen to many of them, but until you actually, get into the milieu and just start messing around and interacting with people and dealing with resistance and fatigue, and certainly during a pandemic year, you can't teach it. It's like athletes they can practice all they want until they have game time. That's when the real athlete shows up or not. Leadership's the same way.
Yeah, I agree. When I think about leadership, and I think about some of the, the more successful leaders that are out there, both, in healthcare, maybe even outside of healthcare, I think there's kind of an emotional development side of leadership, and then there's that business acumen side of leadership. And I really think the two have to come together, right? So, one of the things you've talked about time and time again is, really building that emotional intelligence that will help drive change agility, that will help drive building a strong team. That I think could also then support the execution of a lot of these business activities, such as, financial performance, understanding what the operational plan needs to be, and just executing on the strategy.
Yeah, well said. I think it's really, there's two things. When I go in and start working with leaders in any teams, the dichotomy is pretty clear. You have people that are results oriented, and you have people that are relationship oriented, and neither one are good or bad. They're amoral. It's just how do we actually get things done is the actual difference between a good leader and a great leader. So a good leader on the results side drives performance. That they just and in our culture that tends to be an advantage, checking their side of the box. People that are relationship oriented, they try to engage the people to drive the performance, and it's another effective. But you got to have both. To your point earlier, Dan, it's not an either or, it's an and. And so emotional intelligence has surfaced and emerged as a prominent skill and concept that is being tossed around leadership, primarily because we realize, well, in large organizations, some of the systems that you guys work in at Lumina, one person can't do it. It requires hundreds and thousands of people. And so leaders have to learn how to get things done through others. And the old carrot and stick motivation 101 doesn't work anymore. Daniel Pink did some great witness in his book called Drive about 10 or 12 years ago. And he just debunks the whole motivational theory that you just give people more money or you whack them harder if they don't do it. And it's a it's a go-to skill set. Everybody thinks it works. Some of us were raised in our families that way. I wasn't. I was actually raised by love and probably needed a little more whack, to be honest, if I was being really transparent. So yeah, it's not anything really new. My favorite definition of leadership, my favorite principle of leadership is that if you want to grow a leader, you got to grow a person.
Right.
And so the principle is people follow you more for who you are than what you do.
That's a great point. Absolutely.
Yeah, they need to know the number one characteristic by one study that's been around for 3 decades that people want in their leader is honesty.
Yeah.
And so that sense of integrity and honesty and credibility, that doesn't come from just driving performance. Sometimes it takes away from a sense of honesty because the greed factor kicks in and people project onto them that that's all they care about as a result. They don't really care about me and my family.
Mm-hmm. Yeah, well, and you can see that, but to your point, I think those attributes are really what drives a strong leader. Well, in some of the work that we've been doing, certainly around helping organizations support their both financial performance, support a lot of their patient care activities, we've identified a real need for leadership development, particularly physician leadership development. And are really excited to partner with you on supporting a lot of these leadership development programs and these different initiatives. Maybe you could spend just a couple of minutes, Doug, talking about, your ideal program. And I know, you've spent a lot of time working with organizations, academics, non-academics, helping to develop some of these leaders. Talk a little bit about your program. What have you seen that have been successful? And then maybe we can spend a couple of minutes talking about how, we're connecting that with the business side, which, as we've talked about, I think is critically important to drive a lot of the success.
Mm-hmm. Yeah, I'm very excited to partner with you as well. I think we could do a lot of cool things together. So I'm very excited about what we're going to talk about next. First of all, let's just historically look at this. When I entered this field from doing clinical work as a psychologist into doing organizational work, the big mantra was training. Train. So, I wasn't a big fan of training because I didn't really feel like training was all that effective. But so I resisted the temptation, but training was the thing. And then this field of coaching emerged, which is sort of that one-on-one mentoring kind of relationship. And so I jumped on that bandwagon because it fit me better in my the way I think about how people grow and learn better. Is I think just hammering people with how to do something, especially with physicians who have a strong sense of physician agency. They want to be autonomous. They don't want to be told how or what to do anything. So coaching made a lot of sense to me. And then as I spent a decade or so coaching people, Dan, I noticed there was something else missing. And I'm like, I can't believe I missed this gap. But you can't do coaching and leadership development in a vacuum. If you're my client, Dan, and I'm working with you and your supervisor or your team have no relationship with me and they don't even know what we're working on because you don't want to tell them that you have a coach, it has a limit of its efficacy. And so I started pushing my clients to let me work with their teams. So I think the evolution then went from coaching to team-based development. And then I think we're still missing it. I really want to see, I love team-based learning if we could do that. So I've been doing a lot of work in that area, as you know, the last 7 or 8 years around Patrick Lencioni's work. I do think there's still there's probably many, but one more iteration hasn't been as effectively tried. And that is, let's get people around their peers, not just their team, but their peers, other people, and get them learning together. And so I think we've got to develop what I'm calling small group facilitated conversations. Get about 10 or 15 people together and have them learn in a learning track together, so that when they go out to really solve those practical problems you mentioned, it's real. I mean, these are skills we're learning together, and now we're going to practice them together, and we can hold each other accountable.
Well, and I agree. And that approach, I think, is one that could be highly effective, because what it does is it allows people to learn in their environment around something practical. And you start to build that team approach where you really rely on one another for a lot of the practical aspects of delivery, of execution, and so forth. I'm excited about that. And I'll tell you, when we were really thinking about the idea way back when around building some level of a leadership program, I spent some time talking to both physicians, successful physician leaders, and those that have struggled with physician leadership. And they all said one thing. They said, we need to have a learning program where we can actually build it around our teams. It's something practical. It's skills that we can actually use and execute on. We don't necessarily want to read it out of a book. And I think to your point, right, it's bridging that knowledge gap, right? And if you can do it in a team-based approach, that, in my mind, is really what's going to drive that success.
Yeah, especially when it's peer to peer as opposed to subordinate to superior, because there's that hierarchical barrier that it's just really difficult to cross.
Yeah, absolutely. Yeah. Well, one of the areas that, I know we're working on is something called the Lumina Leadership Institute, and it's a leadership development program that we're going to try. We're going to see how it works. And I think, I'm really excited about it, Doug, because I think, what it does is it brings together a lot of the work that you have been doing for years. And I know a lot around your research around leadership development. It brings it into a very practical structure, combined with a lot of our business activities, our business training, our business acumen, to help organizations really thrive. And I'm excited to see where this goes. I think it could be something very distinctive for the healthcare community. And I think, from my perspective, I think it could just drive tremendous amount of value in a way to give back to the industry.
Sure. Yeah, let me just highlight a couple of things there. What we're talking about doing is to create peer-based learning and small group learning and case study development in a customized, in your environment. So taking a sort of an institute type learning into your organization, let's just say Hospital X, and we're going to get on their site and start teaching and training and coaching and mentoring together in a peer-based environment. Hopefully we'll begin with physicians, but also we hope it will merge with nursing and also, the leadership, the executive team. So we're excited about trying that. And we think the real differentiator is connecting that back to strategy. And that's one of the things you've taught me, Dan, is strategy is so important to being effective as a healthy organization. And we need a thematic goal that we're all driving for. And so what a cool opportunity to say our strategy is to create really create a differentiator out there in the community, but we do it together and we learn together the skills to how to do that. And so those are some distinctions that I think are exciting that we're going to be doing together in the near future, hopefully. And thought it would be helpful to talk about. So.
Yeah, I agree. And, I think what excites me about this is, some of the things that we've talked about, let's say around emotional intelligence or change management or change agility. And as you said, tie that into the practical components of executing around a strategy.
Right.
And I think it's something going to be very new. And I can't help but get pretty passionate and excited about thinking about the opportunities that are going to come out of this. It could really change the way that leaders are developed and the way that they really think about solving problems and building their businesses and so forth. It's an exciting opportunity.
Yeah, there's the early adopters are already doing it, right? So a portion of the people can connect the dots on their own, but people are busy and they don't make the connection between, oh, I need to learn how to manage conflict better so that we can drive the strategy that we've decided. Oh, it's like it just didn't occur to them until I'm having conversations with them. Once that light bulb goes off and they start to recognize the connections, the new skill of emotional intelligence now has traction because it's useful. It's not just this psychology, not just a psychologist talking about warm fuzzy stuff, which I know is your favorite thing, Dan. So we don't want
very
any
warm and fuzzy. You know that, right, Doug?
Yeah, we don't want any of that hand holding, singing kumbaya stuff. So as we teach sort of psychological or soft power skills, they need to be channeled into what they're there for. They're there to drive the other side, to drive the results. And once people, have that insight and make those connections, they're like, oh, okay, go ahead and teach me. We need everybody. Healthcare is so interdependent, and we've got to get people working together more than ever. I mean, I know everybody's saying that, but it's true. And when I first started working with healthcare systems, I used to say they just don't know how to collaborate. They only know how to compete. And I think that has to change. We now are, we're working together. They're merging community hospitals that were competitors into systems. We're now working with the payers. We got to learn how to collaborate, and it takes real skills. It's not just going to happen because we want it to.
Right. You have to have the commitment to work together, the commitment to collaborate, the commitment to, to align all your goals and towards, that common goal, that common objective. Well, I share your excitement on this, Doug. I think this is going to be great. If anybody's interested in finding out more about this, obviously they can go to the luminahp.com website under institutes. There's a lot of information there. And Doug, I'm going to give you an opportunity to promote yourself for a second. You just released a book. I haven't read it yet, but it's on my list to get and to read, but I've heard some great things about it. So maybe you can give yourself a little plug.
Yeah, it's actually not out yet, so you'll have a copy as soon as it is.
Okay.
It's
that's probably why, yeah.
Yeah, we're doing the final editings, but this was not in response to the COVID-19, but about 2 years ago, I started working heavily in the area of physician resiliency. So I pulled together my best learnings over the last 20 years and have put together a useful trail guide, if you will, for docs on physician resiliency called the Resiliency Quest. So excited to do that. Just started a podcast of my own, so that's just in infancy, so that's fun as well.
Oh, that's awesome. That's great. Well, Doug, thanks for your time. This has been great. And, like I said, definitely looking forward to working with you on this. I think you've been extremely successful in your career and have done so many great things for so many leaders and organizations. And here at Lumina, we're just looking forward to kind of combining our support and our solutions and really making a difference with healthcare and these new emerging leaders. So I want to thank you for everything, and good luck with your book. I know it's going to do great.
Thank you. Appreciate the shout out. That's fun.
Shaillee, what Doug talked about, again, I'm passionate about it. I've said for the longest time, strong leaders is the key to executing any strategy. And it's the key to overcoming the challenges, as well as really moving the organization forward, especially in healthcare. It has a direct consequence to the quality care that's being delivered and the success of our organizations.
Absolutely. And I like what Doug pointed out. Our physician leaders certainly are very, very bright, very capable, have the right clinical and operational skill set, whether they're coming with the business background that they have learned, but really what has emerged more and more, especially in the last 18 months, is the need for emotional resilience and emotional agility, as Doug called out. And I think, if anything, COVID taught us was how it was put to test throughout our healthcare system, but very specifically for our clinical caregivers there. So that continues to become an important set go forward. And I also liked how he sort of talked about there are various forms, various methods of learning. Perhaps the more effective, and what Doug is promoting, is hands-on learning in a group environment. So you're not just learning concepts, but you're really solving for real-world problems And that's what you can take forward. So it's practical, it's relevant, and it's almost real time to what you are really expecting. So I'm quite excited to see how LLI, Lumina Leadership Institute, accomplishes that. And I'm very excited to hear about Doug's take on it.
Yes, absolutely agree, Shaillee. I think a lot of the things around LLI is going to be exciting, definitely exciting to see where this whole all goes, and exciting we're working with Doug. I think it's going to be great. On a personal note, this is your last podcast with us, unfortunately. You are going to be moving on for our audience sake, just to kind of let them know. And Shaillee, I can't thank you enough for supporting Value-Based Care Insights, working with me. You and I have worked together for a number of years. I think it's been over 10, if I'm not mistaken. So quite some time.
13. Close to
13
13.
Oh my gosh.
Yes.
Yeah. So I know it's not a long goodbye. You're just going to be moving on to another organization, but that gives you an opportunity to come back as a guest, and we'd love to have you back.
Absolutely. I have thoroughly enjoyed, Dan, our journey, our working together in various capacities. I was actually listening to one of our earlier episodes last week, and we've come a long way finding our rhythm and having really fun with these conversations. And I hope our listeners get that vibe too, that we really enjoy learning, talking, chatting with our guests and thought leaders in the show. And hopefully our listeners, you find some good nuggets, some value from these lessons learned and these conversations. So I want to thank you, Dan, and I want to thank Lumina for this opportunity. And I also want to thank our listeners for tuning into Value-Based Insights podcast by Lumina Health Partners and supporting us. We at Lumina continue to be your partners in your journey to value-based care and all the pivots and challenges the industry is going through. To learn more about Lumina, visit us on luminahp.com. And if you found value in today's conversation, subscribe to us on all major podcast platforms, including Apple and Spotify. And don't forget to leave us feedback. Join Dan again, wherein he continues to deep dive into what lies ahead and invite conversations with several of colleagues and industry thought leaders on new trends that are emerging and how we all collectively continue to navigate and thrive in this new normal. Until then, have a great day.